Hello, everyone. Welcome to the SNMA Sowing Seeds Specialty Series. My name is Lauren Bagneris. I am the current SNMA Specialty Interest Group for PM&R Head Liaison, and I am so lucky today to be here with all of you to have these amazing panelists for our Sowing Seeds program, which was created by our SNMA National President, Asose Obo, in collaboration with the Alumni and Multicultural Affairs National Committee. And this has continued with our current national president, Nita. Throughout this year-long program, we will be providing resources on how to succeed as a pre-med and medical student, and we'll touch on everything from financial literacy to preparing for board exams and everything in between. So make sure that you are a national member by visiting thesnma.org and signing up to stay in the know. To begin today's Sowing Seed series, we'll be starting with the introduction of our amazing panelists. So starting with Dr. CJ Plummer II, who is an assistant professor, medical director of brain injury program at Vanderbilt Stallworth Rehabilitation Hospital.
Yes, hello everyone. Happy to be here. Go by CJ Plummer. This is when we're supposed to kind of be answering some of these questions.
Not exactly yet. Okay. Just start with the introductions, and then I'll ask the questions right after. Thank you.
Absolutely. So I'm here at Vanderbilt. I was in medical school at George Washington in DC, did residency, University of Texas Health Science Center in San Antonio, Texas, and then brain injury fellowship at University of Washington in Seattle. So happy to be here.
Great. Thank you for coming. Next, we'll be introducing Dr. Benicia Williams, DO, who is at PM&R at Fort Worth.
Yeah, so Dr. Benicia Williams, I am in my 4th year in private practice in Fort Worth. I'm happy to be here, and I'm excited to answer your guys' questions.
Thank you for coming, Dr. Williams.
Thank you.
Next, we have Dr. Annette Grother, who is an MD, MPH, and CEO of the Shop Docs, a PGY3, and at Aventura Hospital and Medical Center. You're muted right now.
Hey guys, my name's Annette Grother. I'm currently based in Chicago at Northwestern, doing my 3rd year in PM&R residency. So happy to be here and get to know you guys, hopefully.
Great, thanks for coming, Dr. Grother. Next, we'll be introducing Dr. Emmanuel Achiolike, who is an MD, PGY4 at Baylor College of Medicine.
Hey everybody, thanks for having me here. I'm excited to talk to you all about my journey, my story, and listen to you all about whatever we can do to help out.
Great, thank you so much for coming. And lastly, we'll have Dr. Nweke, MD, PGY3, also at Baylor College of Medicine.
Good everyone. Happy to be here today. Hopefully we can shed some light about PM&R and about the journey so far.
Wonderful. Well, thank you all so much for coming. We're so excited you took time out of your schedules to be here with us tonight. I think it's going to be a really great discussion involving your personal stories and then hopefully answering some questions for interested students, hopefully going into PM&R. So to begin, would you mind saying where you trained for medical school, where you are now, and how you chose PM&R? And we can start with Dr. Plummer.
Absolutely. Sorry, I didn't follow instructions. I said some of this already, but yeah, I've been here at Vanderbilt for 3 years, and I've been serving as a brain injury medical director here for 2 of those 3 years. Like I said, I went to medical school at George Washington in Washington, D.C., and kind of from that area. I was born in Tacoma Park, Maryland, so I've moved around quite a bit. And then went to San Antonio for residency, University of Texas Health Science Center there, served as admin chief there, and then went to Seattle, University of Washington. So did brain injury fellowship out there. And then this is my first job since this is my first and only attending job I've had since finishing training. So, and then what was the last question?
How did you choose PM&R?
Yeah, so a bit of a journey for me. I didn't know anything about PM&R going through medical school. And I was kind of going towards internal medicine more. Not that and this is no dig at internal medicine, but I wasn't really all that excited to be going that route. I just really didn't know what to do. And so I came across PM&R by chance through sports medicine, actually, and got interested in concussions, and then spent some time at NRH in DC shadowing, and really fell in love with the focus on function, and really trying to get folks back to where they were previously from a functional standpoint or better. And then brain injury, I just couldn't get away from it. I drift towards sports or drift towards even like spinal cord injury for a little bit, but really just always kind of came back to brain injury. And it's just that potential for recovery. That's my favorite thing to see. And so that was kind of, in a nutshell, what led me to PM&R.
Great. Well, thank you so much. Next, we're going to move to Dr. Williams. Where did you train for medical school? Where are you now? And how did you choose PM&R?
So I trained at Texas College of Osteopathic Medicine in Fort Worth for TCOM for medical school. And I did my residency at Baylor University Medical Center in Dallas. And then I did a sports medicine fellowship at John Peter Smith Hospital and TCU in Fort Worth. So I'm in private practice. I've been for the last 4 years. I chose PM&R because in undergrad, I was a kinesiology major, and I thought I was going to go into physical therapy. So my senior year, we had to do a rotation, and I did a physical therapy rotation, my clinicals, and I was like, oh, this is fun. But then I also did one with a sports medicine physician, and I was like, I enjoy this more. So I finished my degree. I'm non-traditional, so I had 4 years off in between medical school and college and medical school. So did my prereqs, worked for a little bit, did a master's program, got into medical school. In my first year, I was, how you have the different interest groups talk. So this guy comes and talks. His name is Dr. Omar Salad, who's now my mentor, and he hired me into his practice. He came and talked and was like, oh, if you like, anatomy, you like sports medicine, you like neurology, this is like the perfect mix of it. You'll probably really enjoy PM&R. I was like, oh, that sounds good. So it happened to be my very first rotation, my PGY, my MS3 year. I was very lucky to get that set up, and I fell in love with it on that rotation. And here I am now.
Great. Thank you so much, Dr. Williams. Next, could we hear your answer from Dr. Achiolike, please?
So yeah, my journey to PM&R was pretty long and interesting too. I remember, so I first heard about PM&R through an SNMA event. Ironically, it was a local SNMA event we were having at UT Houston, where we were partnering with with LMSA as well. And I met Dr. Verduzco Gutierrez, and she was like, yeah, I'm a PM&R doctor, and she was pointing at this boxing match, and she's like, yeah, one of them is my patient. And I was like, what is PM&R? And I didn't think about it past that point, but when we were picking electives for third year, that's when I eventually came into like, oh, I heard about this, let me try this out, and I ended up liking it. Just a little bit of background. Originally from Dallas, Texas, went to undergrad at the University of Texas at Austin. Eventually went to medical school at McGovern Medical School. Ended up having to repeat my third year at McGovern Medical School. Had a whole bunch of academic difficulties. Eventually matched the Baylor College of Medicine, and right now I'm PGY4. I'm applying sports medicine, and that has its own difficulties as well. So, but it's been a great journey, and it's a lot of life lessons, as well as a lot of ups and downs, but a lot of good things. I feel like I gravitated towards, because kind of going through third year, you always wonder what happens after the hospital. And it was really good to see that once people get sick, there is a place where they can go and they can get better. And you start to see the progress happen fairly quickly when they have the right resources available to them. So I always liked it, because it was that trend. Sometimes it would serve as this transition where people would be really supported as they get ready to go home. And then also the musculoskeletal component of it as well.
Thank you for sharing that experience. Next, we'll be going to Dr. Grother. Where did you train for medical school? Where are you now? And why did you choose PM&R?
keep forgetting to unmute myself. Sorry about that. I did my medical school training in University of Miami, Florida, and there's one in Ohio, apparently. I just learned that because I moved to the Midwest, so I have to specify that it was in South Florida. But I did my intern year at Aventura Hospital, and then now I'm at Northwestern at Shirley Ryan Ability Lab. I was interested in PM&R kind of throughout medical school. I first learned about it actually. I was also a non-traditional student, so I worked at an orthopedic practice between undergrad and applying for medical school. And so they had a physiatrist there, and he was like the nicest guy. We got along great, very chill personality, and just loved teaching. So kind of gravitated towards working with him. And then I don't know, just like throughout my life, I've always been pretty active, physically active, like nutrition, like a more holistic approach to health. So when I was in medical school, I kept on gravitating towards PM&R because that's kind of the perspective that they started to have on patients. And then I'm not going to lie, I think everyone's mentioned, at least everyone so far has mentioned some of the benefits of PM&R. But to me, the first thing that attracted me was just how nice people were. Like everyone I approached in the field was so friendly, was so open, and they were just very positive and happy people, which I just going through medical school and medical training, you see some specialties and some people, they're not very happy and they don't really enjoy what they were doing. So that was definitely something that drew me in. And then the more I learned about it, the more I realized how much there really is in the field. The cool thing about PM&R is that you train as a physician, you learn all of these medical skills in medical school. And if you subspecialize, a lot of times you lose a lot of those skills. So with PM&R, we actually still use a lot of internal medicine. So we get to use our medical school training, but then we have all of these abilities to do procedures or work with very technical, like prosthetics. So the variety that you can actually do in your practice after graduating and after completing residency is so exciting. If you're the type of person who gets bored easily, like you have so much that you can learn and grow, and you can be really a leader in the PM&R field. So those were all things that, once I knew about the field, really attracted me.
I feel like y'all are definitely continuing the trend of being extremely inviting and friendly. So y'all are going to just create a whole nother generation of physiatrists. So thank you for that. And then lastly, we'll go to Dr. Wicken. Where did you train for medical school? Where are you now? And then how did you choose PM&R?
So I went to medical school in St. George's in Grenada. So I had a bit of a challenging time getting to medical school. And I was fortunate to be able to go to medical school out there. After then, initially, my drive to go into medical school was I had heavy interest in being an orthopedic surgeon. And I unsuccessfully, I was successful with that voyage, and along the way towards the end of medical school, that's when I became aware of physical medicine rehab. It was really just a lot of the sports and musculoskeletal interest that got me through the door. Then I became very interested in treating pain and things like that. But just now being at Baylor College of Medicine, getting my PM&R training, I've been able to experience a wide breadth of the field, most notably in the pediatrics end when you see a patient or infant come in with brachial plexus injury. I think it's pretty neat to understand how many individuals are involved in that in that care. That's how PM&R is. We work with multiple specialties focused on making sure that the patient is able to have all their need, just to be able to get back to the function that they were at before, or be able to just function in general, to be able to do the thing that they love to do. So I think to just to echo what everyone else said, especially what Dr. G said about everyone being super nice. That's another thing that got me in the field as well. When you go to these conferences, you're able to appreciate that. You're able to see many people communicating, be able to communicate to you, open to mentorship, et cetera, et cetera. So that's one of the things about PM&R environment, that even when residency is tough, the environment itself just helps you, get through the process. So hopefully today we can kind of touch base deeper on many aspects of PM&R. Also, in addition, I will be applying for pain management, and hopefully that will be the next stage after finishing residency.
Thank you all so much for sharing your journey with us so far. It's, really great to hear from all of you and see the success you've all attained thus far and what else is to come, because I know there's a lot to come from this group. Going from that, I think several of you mentioned the importance of having a mentor and how mentors have gotten you along this journey so far and where you are today. Could you explain how you found mentors and what impact they had in where you are today, and how people can hopefully attain these mentors that will help them be successful in their journey? We're going to go in the same order we did last time. Also, if anyone has any questions, please put them in the chat and we will get to them as soon as we can following the questions we have prepared.
Yeah, so mentorship for me has been huge. It's something I continue to benefit from, and something I try to create for people who are, coming behind me. I think one of my first mentors in this medical journey, it was oddly enough towards the end of my medical school, and I wish I would have gotten established with her sooner. Her name is Dr. El Bayumi. She's actually an internist up in DC, and I met her. So it ended up being a blessing that I had some initial interest or sort of default interest in internal medicine. I met her through that because we were supposed to be, getting plugged in with a faculty advisor for whatever field we were going into. And so I started meeting with her, and she really was the one who really got me back on track. I had just a lot go on during medical school, just from like a personal life standpoint. And, thankfully still done relatively well in medical school, but it was not easy. And so she got me back on track just in terms of, starting to build that confidence back up and really starting to kind of start looking ahead in terms of ways to position myself well in the future. And so I really attribute that to her. And then as I started residency, I met a lot of attendings along the way, many of whom I'm still in contact with, that really have just been wonderful for me. I'm still in contact with my program director, Daniel Dimitru. He is a very intense guy, but one that, especially during my chief year, really provided a lot of professional mentorship and sponsorship for me, and guidance. And then as I transitioned into fellowship, I'd say one of my co-fellowship director, well, both of them really, to be honest, I'll mention both of their names. Jennifer Zumsteg out of University of Washington. She was previously the program director there. And then Cherry Jun, who is the current brain injury fellowship director out there. Both of them really took extra time during my fellowship to provide not only the medical, kind of mentorship from a medical standpoint and academic standpoint, but also just from a professional development standpoint. And so really, really enjoyed and still enjoy conversations with them. I still run things by them, and they've been not only mentors, but sponsors for me as well. And I don't know, there's just so many people along the way. Dr. Gutierrez down in San Antonio, she has been fantastic as well, especially from a brain injury standpoint. And so, you really have to find mentors and sponsors who are really going to be in your corner, who are really going to add value to the work that you're doing and that you want to be doing. I can't emphasize that enough. And then be that for someone else as you're coming along the way, to pay it forward.
Thank you so much. Next, we're going to go to Dr. Williams. I'm going to give you a catered mentoring question. Could you give some students some advice of how to shoot your shot with a mentor, how to actually form that relationship and what that might look like?
No, that's a good question, because I get asked this often. I think you have to, it's almost like a dating relationship, right? You have to fill them out to see if this person is the right person for you. You have to be a little bit, you have to be resilient and you have to be persistent, because you have to remember, especially if you're doing like attending, I'm in private practice, I work a lot, and then I keep my like practice and private life very separate for myself. So when I'm off, it's like I'm off. So you have to be resilient with that. And when you are offered the opportunity to talk to a mentor, you need to do it on their time and make yourself available, because again, time is of the essence for them. So yeah, you just have to ask, shoot the shot and say, hey, do you mind if and you don't necessarily even have to say, can you mentor me? Just say, hey, can I have a conversation with you? And then you form a friendship, because it really is almost like a professional friendship. Like one of my mentors from medical school is Dr. Linda Cunningham. She was a Black woman pathologist, and she's literally my friend now. She's retired. We go to lunch like once a month and talk on the phone, just catch up. So through that professional friendship, it's become a real friendship. So you got to be resilient and persistent.
Great. Thank you so much. Next, I'm going to ask a catered question to Dr. Achiolike. What would you say is what you're looking for in a mentor? How do you find out what to look for in a mentor, and then to, then go forward with that when you're looking for one?
I've been pretty lucky. And let me shout out my mentors, though, the main ones. I've had a ton, actually. As far as PM&R goes, Dr. Achiolike, UT Southwestern, Dr. Skelton, who's here at Baylor, Dr. Merritt, Dr. Scholas, who like at our first PM&R, when me and Anthony and Lauren and Chisholm, we weren't even registered. We just showed up, and they kind of, took the time to sit down and motivate us. But as far as what I look for in a mentor, I really just look for someone where I can be myself to a certain extent. I think a lot of the time within our workspaces, we're not given the benefit of the doubt with some of the things we do. We're not asked for kind of an explanation for the things we do when we're just trying to be ourselves. And I feel like within the safe space I had with, Dr. Achiolike and Dr. Skelton, they allowed me to be myself and still were able to prop me up. And they just believed in me. And, a lot of time, my other mentors like Dr. Smart, who's a neurologist, or, they just believed that I was capable and fed that into me. So when things would go bad, it was always nice to have someone on the upper side, saying, no, it's going to be okay. Also, my brother's a neurologist too, so he played a huge role. Another thing is, I feel like at this stage, being a PGY4, I realized how much work mentorship is. And it is and I don't mean that from a negative standpoint. I mean from a lot of the people who are now like med students and, PGY1s and PGY2s, they ask me questions. I'm right where they used to be, and I'm where they kind of want to be to a certain extent. And it's kind of interesting because even though it takes a give and take relationship, they have a lot that they can offer me as well. I realized when I have direct access to this attending who wants me to do this research paper or write this poster, every time I'm like, hey, I have this project. Do you want to get on it? And they'll do all the work, and I'll just have to fine tune. And that's something where we offer, to a certain extent, some access and perspective, whereas they can do some of the footwork. But at the same time, it very much is a relationship where anyone I try to mentor, and anyone I want to mentor me, I want it to be a very, to a certain extent, a personal relationship where we can be open with each other.
Definitely. Well, thank y'all so much. And with that, so now we know how to shoot our shot and what we're looking for. Dr. Grother, what would you say? Where do I look? Where do I look if I want to find a mentor? And then, what is the proper way to kind of ask about this? I think you're muted right now.
Keep forgetting to unmute. Sorry about that. So I would say you can approach pretty much anyone, especially in PM&R. Again, I'm going to emphasize that we're all pretty friendly and open, and we all are excited about people being interested in our field and wanting to get them involved. So if you found out someone was a physiatrist, You could just ask them to set up a meeting, set up a coffee, something along those lines. I think it's, easier if you're at a conference and you kind of already know someone's area of interest. You might be able to see one of their talks and then ask them a question afterwards, and then offer to share your contact information or ask for their contact information, and find a way to like follow up, just, thanking them for meeting them. And then in the future, you can kind of present like, oh, I'm really interested in this one thing. Maybe I could pick your brain about it in the future. So I feel like that's a really good like pickup line if you're meeting people in person. You can also honestly just Google. So this is something I did when I was interviewing or about to interview. I just emailed and set up, informational interviews with people in a broad variety of positions. So like I would go to program websites and find out who the faculty members were, and just if I could find their email, I would send them an email letting them know just briefly who I was, and I was interested in asking them questions about their field or something specific to try to make it tangible for them, and then ask to set up meetings. And I think I had probably 5 different calls from just that. Some of those people I still have run into and have had contact with, and some, like Benicia said, like the relationship has to be, something where you're comfortable, something where it's like a friendship almost. So those would be some suggestions I would think of. You can even find people in private practice if you're interested in that setting. I guess whatever you're curious about, you could Google it, find someone who does it, and then email them. Especially with LinkedIn and Doximity, the way things work, there's so much access. So, going back to the resilience piece, you may have to send a lot of emails. You might not hear back from everybody, but, making 1 or 2 connections from sending maybe 10, 15 emails, that's great. And you are learning more about the field. And those are people that you may see in the future who will probably remember you in a positive light. Like, hey, this person reached out to me, was super interested in PM&R, even as a, M1, M3. And they're going to remember that, and you'll be seen in positive light for future opportunities if they do end up coming up, or for future mentorship relationships.
Great. Thank you so much for that. Going off of these connections, just wanting to plug for SNMA right here. As each panelist speaks, their Instagrams or emails are popping up while they're speaking. So definitely take note of that and reach out to these amazing panelists afterward if you have any questions. And then, going to Med Twitter, going to Instagram, these conferences is definitely a great way to find amazing mentors like all the ones on this panel. Lastly, Dr. Nweke, what would you say is the most important thing about mentorship and what you've gained from it?
I don't think, first of all, I don't think without mentorship, mentors that I would have been here at this point. I think, it's very, very important to realize that when you're seeking out a mentor, you have to really ask yourself a deep question. How intentional are you about establishing this relationship? Because when you have a mentor, it's not only moments that you win, you got to be open to sharing with your mentors your losses. I think a level of vulnerability is important, just so that people can be able to help you. One of the most powerful questions people that want to help you will ask you, how can I help you? And that's one indicator that, okay, this person really want to genuinely help me. And on your end, if you're looking for help, be willing to say, hey, I need some help. These are my goals. And this is where I want to go to. So someone can't help you unless they know what you're trying to do. So it's important for you to be prepared, have your goals identified, have them in mind. And anyone who's pursuing a goal will be adamant. Just like everyone else said already, your mentors that you seek out for are generally people that are already where you want to be, and they're going to be busy. So being diligent and being timely with everything that you do, especially when seeking out help from them, is very, very important. And having a lot of patience is key. I actually just completed a program with UT Southwestern called Heal USA. And one of the sessions talked about mentorship, and I took a note. I just kind of want to share some stuff that they mentioned. When you're looking for a mentor, make sure you have your pitch, right? Because you never know where you're going to find these mentors. Just like Dr. G said, she's seen mentors or sought out mentors at conferences and stuff like that. You have to make sure that you're ready for those moments where you can just kind of seal the deal. It's like a negotiation, the deal whereby you basically kind of develop a bond and you go from there. So I think having a lot of courage and being super intentional are the key components into trying to establish a mentor. So yeah.
Great. Thank you all so much. That was.
You can also have more than one. You can have a ton. You know, you can have all the mentors.
I want to add something. I'm so happy everyone else were able to remember all their mentors. I have a hard time remembering people's name, but I want to note some individuals that weren't in PM&R, but one of my mentors, early mentors, Brian Wanunu. He's currently an orthopedic surgeon. My older brother, Achiolike. Even though I'm older than Emmanuel, I could say Emmanuel's my mentor. You know, vice versa. We mentor each other. We discuss.
Nah. I'm your mentor, bro. It's cool.
You're not my mentor. But yeah, we see. A lot of our peers, like Annette, she's, you know, we all meet each other at these conferences, and I think we're all taking characteristics from our mentors, and when we interact with each other, it's always great things. So don't be afraid to, you know, share with somebody your area of need. Once you put that in the atmosphere, all the help will start flowing. If somebody that you talk to can't help you, they'll keep that in mind and point you in the right direction. Just always know that. So mentorship, I don't think any one of us would be here at this point if we didn't have those.
And can I say this one thing about mentorship? Because you'll get asked this, and the students will be like, oh, well, Dr. Williams, why did you go into PM&R? And I will quickly respond, I'm like, it's irrelevant why I went into PM&R. I want to know why you want to go into PM&R. So have your elevator pitch ready, like Dr. Grother said, because it is, you want to be prepared.
Yeah, I was just gonna have one other thing too. You know, especially as underrepresented minorities in medicine, I think we sometimes fall into this kind of lone wolf status where we're trying to just make it happen for ourselves, and it's a generalization. I know not everyone is like that, but I find that a lot of students that I end up speaking with eventually have kind of taken that route. And I understand why, like there are a lot of obstacles that many of us have had to kind of go over, and not all of those obstacles are in place for others. So you kind of have to have that, like, I'm going to get it done, myself mentality. But, you're really doing yourself a disservice if you're trying to lone wolf this journey. You really need to be getting plugged in and established with people who have done this before you, who can help support you along the journey. There are just some things that you're not going to be able to gather from a textbook or from whatever else you're reading. You really have to get plugged in with people who are just doing it. And so take time and really think about that and really trying to establish that network, both kind of ahead of you and then laterally, and so I just wanted to add that.
Thank you all so much for your insight and your advice with mentorship. I think that's really important. So I'm hoping people are learning a lot. I hear we have some really great questions from the audience. Before we open up to the audience questions, I'm going to ask one last question that is going to be one favorite thing about the field of physiatry. So just give a quick one-liner of your favorite thing. I know the field's amazing, so there's probably several, but one thing. And we'll start with Dr. Plummer.
Oh man, the pressure's on. Mine's going to be specific to brain injury. It's just, like I said, that potential for recovery and seeing a patient go from a vegetative state to, passing driving evaluations when I didn't really know if they were going to do that and they were going to be able to pass any of those things moving forward. It's just nice. It's such a great feeling to be a part of that journey.
I'm assuming I'm next. For me, it's truly changing a patient's quality of life. I consider myself an injectionist. So literally before I go in, I'm like, God, please tell me that this injection worked for this patient. If it's a knee injection, an epidural, a Botox injection, seeing it change a patient's quality of life is huge, and it's very rewarding.
You know, I think what I like how it all kind of comes together and really ends up making sense. And what I mean by that is, like, whether you're in spinal cord injury, you're going to end up, like, the knowledge you get from spinal cord injury is going to be useful for EMG. The knowledge you get from EMG is going to be useful for MSK and pain. The knowledge you get from brain injury is going to be useful for sports, you know, and MSK and stuff. Because, you know, whether you're doing injections for Botox or this, it all kind of comes together. And the thing is when it first starts off, it almost all seems like different little pieces. But, like, when you hit, like, mid PGY3 year, you're like, oh, this is all kind of coming together now. Like, and it makes sense, you know. So that's what I like.
You can go, Dr. Grother. Yeah.
Okay. I would say maybe this is like a hippie answer, but being able to kind of connect with patients, and a lot of times we have the ability and the privilege of helping people reconnect with a new sense of purpose, because a lot of the patients we deal with, their whole life has been rocked and entirely changed. And that can be very, very distressing to them. But I think in our field, just because of the amount of time we get to spend with patients and the way that we interact with them and just our approach to medicine in this more holistic way, we really are like someone who's pivotal in helping people reconnect with some of the things that they're passionate about doing, or helping them to be able to do those things again. They haven't done them for years. So that's really, really very valuable to me as a physiatrist.
I think my response, one of the things that, you know, I've appreciated the most about this field is, or just in general, being a physician, but specifically to physiatry, is that, you know, you're an extra hand, you're an extra set of limbs, you know, especially, you know, for these patients. I'm reminded of a patient, my first spinal cord injury, young kid, had a divot injury. You know, we're trying to get things going for him. He has some sacral wounds, concerns, trying to get his bowel regimen going, trying to get some things, you know, functioning properly for him before discharge. Right before being discharged, his grandma bought some clippers. And, you know, I knew I had some skills. So I told him, I said, you know what, at the end of this Saturday shift, I got you before you go to Louisiana. I gave him a haircut, and, you know, just to see some of that, you know, just to see that response, the little things, you know, PM&R, for being a physiatry, teach you about the little things. And when you start applying it to your life, it starts to change you from the inside out. I think it's important to be in a field that can actually affect you in real life, as opposed to doing something that you put on a show when you come into a hospital setting. When it's coming from inside out, you can do it endlessly and never feel tired of doing it. And then you almost don't even feel the burnout, even if burnout is a thing, right? So I think it's the internal reward that you also get as an individual, but also the external reward that you're able to see on the patients that you're treating. I'm sure many other fields can echo the same, but I know everyone on here can say that they chose the right field in physiatry.
Thank you so much. That was amazing to hear from all of y'all. Next, we will be going into the audience questions. And the first audience question is, what can you do in medical school to assist you in becoming competitive to match into a reputable PM&R residency program? And I think for this, we're not going to hear from all 5 panelists. If only a certain few of you want to answer, that'll be fine, so we can get through more questions.
FYI, that's my boy right there, James. I just wanted to add that.
Everybody knows James, bro. Everybody knows James.
I would say, James, you want to get exposure in medical school. It's easier now, I think, than it was when I was in medical school, but exposure is huge. Try to get some research under your belt, and get a good mentor, and a good letter of rec will go a long way.
I'd echo that. Building leadership experience is big as well. You can, and that's in all domains. I mean, whether it's an organization within the community you're involved with, or it's your president of your medical school class, kind of whatever it is. I know that leadership, kind of being on the side of the residency selection process, the leadership can really, really help distinguish you in a lot of different ways, and shows that initiative and a certain maturity. And so I'd say that, of course you want to do as well as you can academically, but that goes without saying. And it's, different places will value things differently based on some of that, but and don't be afraid to add some unique experiences, some unique hobbies as well when you get your application in. A lot of the, sometimes they can get a little redundant in terms of the kind of students mentioning similar things. So don't be afraid to do something, to say something unique. Just be prepared to talk about it in a semi-professional way, but yeah, that would be some of my advice.
I would say, okay, never mind. We're on to the next question. I'll say, are we switching?
It's up to you. If you want to answer that question, and then we can.
Just to direct it straight to James. I think being aware of the process right now in the interview process, screening applicants and stuff like that. Actually seeing how competitive it's getting. Is getting crazy competitive. Sometimes you screen these applicants, you're like, wow, they have like 4 peer review, oral presentation, posters, like intellectual curiosity section, they're killing it. I think most important thing is identify yourself appropriately. Like really don't be somebody that's super researchy, but then that's not really what you want to do authentically, right? Do things that you enjoy. At least have something, but be well-rounded. That would be the best thing I'll say. Shoot for the stars, score well, get on top of research. James, feel free, message me, ask me, hey, what are you working on? Can I be of help in something? Seek those things out. If you can knock off a project or 2 within a semester, next you know you have that on your CV. Most importantly, go into some of these conferences and networking. Some people can have it all, but you don't have the network, and then you're not able to navigate. So I think being a good student, being aware of the community, getting in touch with people that formulating mentorship. I think when you have all those things, those are good recipe for success and being competitive and matching.
Thank you all. I think we're going to move to the next question. What advice would you give U.S. IMGs who have applied this year, specifically for interviews and navigating the process?
Well, since I'm an IMG, and I know that this is very challenging for international medical graduates, especially in fields like this that's getting more competitive, I would say reaching out to people who in programs that are international medical grads, understanding their process. For me, what helped me was I did a year with Dr. Stiddick and Dr. Ford in New Jersey, and people know them, and they know the process that they make people who work for them for that year go through. So because of that relationship that they have with other programs around the country and fellows that they've trained, that was something that was super helpful for me, getting the amount of interviews that I received that year that I was with them, and then ultimately matching. So I would say figuring out who is an IMG at programs that you're looking for, reach out to them, whether it's LinkedIn, Instagram, Facebook, email them, bother them. There's this thing about with IMGs that we can't forget ourselves. Once I know someone's an IMG, you understand that journey from when you started it. So they'll be able to help you. Now, on top of that, when you get an interview, it's super crucial. You treat preparation, very, 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 very well. Like do mock interviews, understand that interview day is just as important as submitting that application on time. So the more practice that you put in, the easier your communication is going to be on the day of the interview. And when you're able to do all those components, it should help you be successful to match.
I just want to throw something quick into one of the things I've seen from IMG applications when screening applications. A lot of the IMGs just, they don't have a lot of PM&R experience, and it shows in their personal statement and in their letters of rec. So even if you're an IMG, the first step is getting exposure to PM&R and getting some support as far as mentorship goes.
Thank you. Okay, so I think we're going to go to the next audience question directed to Dr. Williams. Do you use OMM often while treating patients? If so, can you describe some of your most commonly used manipulations?
The answer is no. Simple. No, I'm sorry. I actually don't. I don't have enough time because, like, private practice, you got to go. So I think when you're doing OMM, you have to be able to dedicate that time. And unfortunately, I don't have that time to do it. If I do it, maybe a couple times a year, and it's usually like a piriformis release or like a suboccipital release for a patient that's a migraineur coming in for migraine Botox. So, but I don't do a whole lot of it.
For those of you who work with other DOs, do y'all see OMM frequently, or is it kind of the same thing about the timing?
I will say my friend Ugochi as Wicken, she is also fellowship trained in regenerative medicine, but she takes the time. She's also in private practice, but she blocks out the time, and she kind of builds it into her treatments for injection and a little bit of OMM and a little bit of this little razzle dazzle. So she does.
I see it a lot in the resident room. The DO students who are rotating through, and some of the DO residents will perform. They'll perform it on me when I'm having like a stiff back, and I'm like, man, thank you for being here. It's really helped me out a lot. So yeah, that's only.
I echo that. I was a recipient. My SI joint has been bothering me. One of my co-residents from UT, he performed that recently, so I know exactly the experience Emmanuel was talking about.
And I will say, I will refer to another physiatrist in town that does OMM. She has her own OMM clinic. So I will refer patients over to her because she's better in it than I am.
Great. Thanks so much. Okay, I think we're going to go to the next question. Let's see. They said, thank you so much for taking the time to do this. This is coming from an MS2, and they say they're pretty set on PM&R. I do not blame them. How important do you think having research on your CV is for matching into a PM&R residency program?
I would say that it depends on which program or what type of program you want to go to. I had a broad array of interviews, and I did have a pretty extensive research background. So that helped me to stand out, especially at academic institutions. They really valued that. They asked me about my research. They were impressed about the amount of research I had done within and without or outside of PM&R. And then I went on some interviews and they were like, why are you applying here? Like, looks like all you want to do is research. And so I think this question really lends itself to the fact that like programs have a specific fit. And the more you really kind of lean into the things that you're passionate about and really like take the next step, take leadership positions in that, do something that's like kind of stands out from that perspective, I think that helps you more than actually like the research itself. That being said, I think as some people have mentioned, PM&R is getting more competitive. So I think it may limit your opportunities if you did not have some PM&R specific research. That doesn't have to be like a longitudinal study that's been going on for 2 years. You publish it, write a book about it. Like it could be a case report, and you can ask any resident at an academic program or any attending at an academic program if you would be able to jump on and help them draft it, help them with the literature review, and that could get your name on a publication. I strategized, like I applied a little or decided to do PM&R a little bit late. So in my fourth year, literally the beginning of fourth year, got on 2 case reports, put them into AAPM&R. When you do that, you have a poster presentation, and then they publish all the abstracts. So you have a publication and a poster presentation. And I did 2 of those, and everyone was like, oh my gosh, you have so much PM&R research. It really took me like a month to do this. So I think those are really good opportunities if you were like trying to find something. I think there's ways to get more involved and do more potentially meaningful research, but that I think is something that people might look for.
And I think the reality of the situation is having like really meaningful research as a medical student, a lot of times it's just luck, because usually that stuff takes like from start to finish takes at least 2 years to really make happen. But I think research, it just shows a commitment to PM&R, that you're interested and you've been putting in some effort. So I think, I don't want to say everyone at baseline should have like some sort of like poster at AAP or AAPM&R, but I think that is something that would definitely show that you're very much committed to PM&R and can be something that sets a solid foundation for your commitment to PM&R.
And that's also, just to jump in, a really good way to find a mentor is if you offer and help to do research for them or with them. Those are really good ways to make those bonds. Any
resident who has a poster, you just ask them, hey, you have a poster you want me to make for you? So, like, because we don't want to do it sometimes, especially like I'm a PGY4, like I'm like, okay, I got like these 3 posters, like I need someone to write them up for me so I can just focus on, fine tuning it at the end.
Definitely. Thank y'all so much for that answer. Lastly, this is going to be our last audience question. Can someone do a PM&R residency and fellowship in anesthesia pain management? How different is PM&R from anesthesiology? Because this person is discussing, they're trying to make the decision between both. So
I got this one. You absolutely can. And a little plug for the virtual physiatry mentors. If you go on my Instagram, that's probably our most popular YouTube video, and it'll be linked on YouTube. And we did a pain management. I did sports medicine with interventional spine trained fellowship. We had a pain management in anesthesia, pain management PM&R program. And we all kind of and then a non-ACGME pain program. So we all talked about the difference. It's like an hour show. It will go over everything, but you 100% can match into an anesthesia pain program. But we have 2 people applying, so they might have some more.
Yeah, definitely possible. I think if you're interested in that, it's kind of something you explore a little bit more during residency. So the one thing I would say is that you apply pretty early in the application cycle compared to other subspecialties. So the earlier you can get exposure, the better. So if you are in residency, and maybe this is too far down the road for you, but I would definitely try to find a program that lets you do elective time early or offers you the opportunity to do those sorts of rotations early, because then you'll have, opportunities to make relationships as well as decide if this is something that you really want to do for the rest of your life.
Great. Thank y'all so much. With that, I think it would be really great to end on one piece of advice. So since we have 5 of you, 5 different pieces of advice, as a student, leaving today's meeting, what would you say is something that is an actionable step that a student should take after today's meeting?
I think I want to share something since it's fresh in my mind. You're gonna be met with a lot of doubt, right? And there's this thing that we all, maybe something I struggle with. Let me speak for myself. But sometimes you may be working and you're working towards a goal, and you're going to have days where you're like, man, I don't even know if this is a possibility. And you come to find out that taking time to ask yourself and thinking negatively wastes a lot of time when you could be taking steps towards something. You don't know how that thing that you're afraid to do, once you do it, you're like, man, I don't know if I should message this attendant about this thing. True story. This case report that I submitted, I'll be blessed to present a case at the Texas Pain Society this weekend. I remember getting out of the shower and I just shadowed at MD Anderson the first day, and this attendant was like, "Oh, I have some case reports. If you would like to, hop on, that's what you're gonna hear a lot." Immediately, I was like, "Of course." In the back of my mind, I'm like, "Man, I have a lot of stuff to do. Anthony, are you sure you can take on this task? The deadline is like a week." I come home. She asked me a PM&R question. She's an anesthesiologist. They don't know a lot about, certain physical exams and stuff like that. So she asked me some questions. I came out of my bathroom. I was like, you know what? I emailed her. It was just the wildest thing. Probably 9 p.m. or 9:30. I emailed her something long, continuing the conversation we had at 1 o'clock. Long story short, that turned the corner. She emailed me the case report that I wrote, that I ended up writing up, submitted without even thinking of, going over there to do an oral presentation. I'm like, okay, just another thing to add because I want to apply for pain. But just looking back and seeing the difficulty or where my mindset was during that time period of taking those steps, but the fact that I still just kind of took a lunge and now looking at the outcome, I just wanted to share that anytime you have a moment of doubt, take that step into that doubt. And you see what happens at the end of it if you do take that step. So if you're thinking about sending an email, either email to me, either email to one of these individuals today. Once this video session is over, send those emails, send those questions. We may not get to them immediately, but once you do that, you're just a step into those things that you want to accomplish. So I just wanted to share that.
I would say my best advice is to believe in yourself, because if you don't believe in yourself, you can't expect other people to believe in you. So if you have to sit in the mirror and tell yourself like you're a big deal, I would do that before I had interviews. I'm like, listen, Benicia, you're the believe you can do this, you got this, and have that confidence. We had an attending talk to us about that, and he was very open about how much money he made. And he's like, just remember, you're a big deal. So I go to meetings with neurosurgeons, with orthopedic surgeons all the time. And I'm like, what I bring to the table is just as much as they bring to the table. You are a big deal. So believe in yourself.
I guess I can go next. Oh, go ahead. I'll go.
Okay. I would say that knowing your why is super important. So I think it came up throughout the talk, like being able to push through those hard times. You have to know your why. When you're going to mentors, you have to kind of know your why in order for them to be able to help you. And then when you go into your interviews for residency, they're going to ask you your why. So I think it's really good to kind of explore this. And one of the things that helped me the most with that process was actually informational interviews, So just talking to people, asking about what they do, you're going to find out so much about the field. You're going to be able to explore different interests you didn't even know existed. And I think through that process, that iteration, you really get a good sense of your why. And when you present yourself at these interviews, they're going to see a passionate medical student who knows stuff about PM&R, who's already networked. They've put in the work to kind of elevate themselves, educate themselves, and they're going to see that passion. I really think PM&R, it's more about that than it is about the grades, than it is about the test scores. Honestly, I'll be candid, my test scores were not great, but I ended up at one of the best residencies. No offense, guys, but and it was because I had able to speak to that in a way that they were excited about and interested in bringing me on board. So I think just kind of exploring your why, talk to as many people as possible, and then your greatness, I'm sure, will shine through.
Yeah, I would say two quick things is, making sure it's a very deliberate process. Really take time to think about where you want to be and kind of what steps it takes to get there. And don't cheat yourself, make a plan, stick to it, stick to that process. Don't try to shortcut anything because, it'll all circle back at some point. And then the only other thing I was going to say as well is, as you're applying for programs, get a sense of where go with the programs that you feel are going to support you. I would strongly recommend against going for a name or anything like that. I mean, if that name institution is giving you a sense that you will feel supported and appreciated, then I would absolutely say yes to that. But I would really, really take time as you're meeting with folks, interviewing, to really get a sense of where you are going to feel most supported, because that's you, as Dr. Williams said, you are worthy, you are worth it, and you don't want to be anywhere that is going to jeopardize that confidence level, because that's what's more important than anything else. I'm sure many of you can make any of these programs work to your advantage, and so just think about that as you're applying.
I want to just, also emphasize be confident and be optimistic and keep pushing. I think that's super important. the whole road kind of beats you down through medical school and makes you feel like a less confident version of yourself, but just continue to be optimistic. And I also like want to say, like, you know, if you have peers going down the same route, try to band together. It's better to, you know, be going down this journey with somebody, and not in a way where you're competing, but where you're truly invested in each other and you know each other's struggles. You know, I'm lucky to have Anthony or Nameka here with me, because, you know, when we have stuff that happens, we talk about it, like, for real, like especially both being Black, you know, we're able to really be like, hey, look, this is what they might be seeing. You know what I mean? This is what you might be missing. You know, we're able to be real with each other. So if you can have people like that, you know, don't be scared to, you know, pull in close to each other. You know, the same 4 group of us that we, you know, that decide to pull in tight, turn into that WhatsApp group that now everybody's in. And, you know, because we all pulled together, and, you know, whenever something's going on, we talk to each other. So
it's just funny. Emmanuel was talking about that. Me and him, we had almost a 2-hour conversation till almost 12:30 last night. You know, just talking about the journey overall. You know, was it APMNR in Orlando?
Baltimore.
Orlando.
You talking about 4 years ago?
4 years ago.
Yeah.
Super broke. Shared the same Airbnb. The only way I knew how to get into the conference, because this was my transition to PMNR, Emmanuel was like, man, we're just gonna finesse this thing. I was like, okay. And then it just somersaulted into what we have now. And it's just it's crazy. Yeah.
Man, yeah, we pulled up. We said, you know, he said, yeah, we can't afford to register. Let's just go ask for a badge.
Exactly.
We fully registered. I was like, I bet.
Y'all have been a phenomenal panel. It's been amazing. Definitely hearing from all y'all tonight. I know a lot of people had to learn a lot. I know I did. So just wanted to say thank you all so much for tonight and making time to come to this and being the mentors that we look up to. We really appreciate your support of SNMA and of our membership. I encourage all of you to follow these amazing panelists on Instagram and the SNMA official Instagram as well. It's at SNMA_official. On Twitter, we're at SNMA, and then also like us on Facebook if you'd like to see future Sowing Seed series and hear more from amazing panelists like this. Most importantly, if you're not currently a national member, please visit snma.org to sign up and get connected. We hope to see you at AMEC in April. Thank you all so much for tuning in, and I look forward to seeing all of you at our upcoming Sowing Seeds webinars.